Hi guys, welcome to Raw Online. This is Dr. Ashok. So today we are going to talk about the one of the most commonest infection which is going to be there prevalent all over the India and all over the world. So which is going to be caused by a spirochete, and it's going to be a bacteria, and it's going to cause genital ulcer, and it's going to have a various stage of infection, and the last stage is going to be the neurosyphilis, which is going to be quite difficult for us to treat the case in case if the patient is going to present to us with the neurosyphilis. So let us see about syphilis. So it is going to be one of the particular infection, bacterial infection caused by spirochete involving the urogenital system, and it's going to be a sexually transmitted infection, and it's going to be caused by the bacterium called spirochete, and it's called as Treponema pallidum. So it's going to be the Treponema pallidum, which is going to be a spirochete, which is going to be the causative agent of this infection, and it was discovered first by the scientist Schaudinn and Hofmann during the year 1905. So this particular question can be asked in your competitive exam, guys. So have a notification about this particular thing. So it is discovered by the Schaudinn and Hofmann during the year 1905. Both the scientist name and the year is very much difficult to remember, in certain point of time. It is always better to remember this particular point. So it is discovered first by Schaudinn and Hofmann during the year 1905. It can be asked in competitive exam like NEET, and it's one of the sexually transmitted bacterial infection, and it is referred to as the great imitator. So it is because the particular infection can imitate wide range of disease during its course of illness. So when the patient is going to get syphilis, they are going to undergo numerous stages of syphilis, and they can present to us with the various manifestations. That is why it is called as the great imitator, and it was named by Sir William Osler due to its varied presentation like gamma neurological manifestation and cardiac manifestations like aneurysm, which is seen during the tertiary stage. And incubation period of this particular syphilis is going to be 10 to 19 days. So whenever the particular patient is going to get exposed to the sexual activity, unprotected sexual activity, exposure to the commercial sex worker or any gay sexual activity, so this particular infection, it's going to take around 10 to 19 days as an incubation period. And following that, the patient is going to go for the clinical features. So again, the particular clinical feature, it can range from a lot of stages. So we will see one by one. So the risk factor for acquiring the syphilis, so it's going to be the unprotected sexual contact with the commercial sex worker. So it's the most commonest source of infection. And the other source of infection, we all know, exposure to the any gay sexual activity and any unprotected sexual activity with multiple sex worker. Again, it can lead to the infection. And this particular infection is not only going to transmit the infection like syphilis, but also the dangerous other bloodborne viral infections like HIV, hepatitis B and hepatitis C, and along with the various bacterial infections like Neisseria gonorrhoeae, which is going to cause gonorrhea. And these are the various infections that can happen when the particular patient is going to get exposed himself to the commercial sex worker, in case of any unprotected sexual activity, they are going to end up in this kind of infection. And now moving on to the clinical syndromic approach of syphilis. So clinically, the patient is going to have painless indurated ulcer along with painless lymphadenopathy. In our previous sessions like Haemophilus ducrei, we have seen, the particular patient is going to present with a complaint of painful genital ulceration along with painful lymphadenopathy. So here the particular thing is going to be painless induration or ulcer associated with painless lymphadenopathy. So which is going to be a characteristic feature of syphilis. So when you guys learn about the sexually transmitted infection, it's always better to remember which are all the following infection which is going to cause painful induration but painless lymphadenopathy. Then painless induration and painless lymphadenopathy, and painful induration and painful lymphadenopathy. So these kind of matching, you should be able to diagnose a particular infection. So it is both useful for the clinical outcome and the clinical diagnosis, and also for the competitive exams like NEET or INI-CET. So with this, we'll move to the stages of the syphilis. So here, we are going to have 4 stages. The first stage is going to be the primary, and the second is going to be the secondary, and third stage is going to be the stage called latent syphilis, and the fourth stage is going to be the tertiary syphilis, which is going to affect the central nervous system and also the cardiovascular system. So we will see about the particular infection in brief in the next upcoming session. And complication, like we are going to have CVS manifestation and the congenital syphilis, and it's going to also involve the central nervous system, where it's going to cause the neurosyphilis and various complication like gammas. And again, like we will see about the complication in brief in the upcoming slides.